Maybe? Okay, it's trying. It's working at it, and yes. All right, so we should be going live on Periscope and on YouTube, and Facebook should join us in a few moments.
Excellent. Hi, everybody. Welcome. Welcome to the BA Zone's live pre-show. And here we are again today. We're going to be talking about the healthcare domain, the business analysts in the healthcare domain again. This time it's going to be around rules and regulations. So hang in there with us. And we're going to be talking interesting things like fraud and how to avoid, getting involved in fraud and then ultimately winding up in jail, which you don't want to do.
That was interesting. That came out as fraud, as Freud, like Sigmund.
Like Sigmund Freud?
Yes.
Fraud? It's that Jersey accent. Fraud, Freud.
Well, one can lead into the other, right?
Well, that's true. If your ego is so big, you think you can stay out of jail. You're wrong.
And they'll show you that very quickly.
We'll show you that.
Okay, so I have verified us on Periscope. I have verified us on Facebook. We're live on Facebook already. Cool.
Very good.
And YouTube. So we are good to go. All right. So we can just say hello to the nice people and get caught up on things here.
Hail, hail. The gang's all here. We're just doing our pre-check. We'll be going live. Well, not live. We'll be starting the live show in about 7 minutes. So in the meantime, we'll just kibitz and chat a while. Hope everybody had a great weekend and a fairly decent Monday, an enjoyable Monday. We had some flooding this weekend. We always seem to be talking about weather because it seems like the winter is never ending this year. And it is like colder than March out there tonight. It's just very bizarre weather. So we don't mean to talk about the weather. It just keeps popping up.
Well,
and we had
so
some,
bizarre.
I know. We had coastal flooding. We were a little Venice down here. I'm down in down the shore this evening. So we had some interesting weather. Little kayaks floating by, and it's always fun down here in weather.
The kids think it's fun, right?
Oh, the kids love it. Kids love it. House is rocking, that kind of stuff. We have a great time.
Yeah, we
house is rocking.
In the basement again, it's just one of those things.
It's happy times, good times.
You live in Jersey, you're gonna get water in the basement sooner or later.
Yeah, exactly. You're exactly right.
One of the laws of the universe.
Hey everybody, don't forget when we I'm sorry, don't forget when we go live to feel free to drop us some comments or questions while we're during the show, and we'll be sure to get an answer to you. Or if you have any suggestions of what you'd like to see in future shows, just drop us a line, and we'll try to incorporate that into our schedule as well. Pollen count is also very high, so I've got that 1-800 voice going again. I'll be taking lots of sips of water. And
see, we should try to figure out how to turn that to our advantage.
Sometimes.
Gotta be a way to, what do they call that? Monetize it, right? We need to monetize when our voices are shot.
Good grief.
That's the best I can do. Alrighty then. I guess I should bring myself up and stop hiding now that I can actually look at the screen.
That's right. Say hello to the fine people.
There we are. Am I dark here again? Hang on, I'm going to go and bump the light a little bit while we got a second.
Oh, the lighting has come up a little.
If I go too far, I get completely washed out. If I go too dark, it looks like I don't really exist.
Actually, my lighting is much better here.
It is. Can we bottle that and take that back with you?
Yeah, exactly. I have to hang some ceiling lights.
Oh, is that what's doing? What, do you have like cans up there?
Well, I have. It's like, yeah, they're on like steel poles. They come down and they've got the nice little. They kind of look like little. I don't know, something you'd see on a lighthouse or something, I guess. They're kind of cute.
Oh, that's cool.
So they provide perfect frosted white light.
Oh, see,
amazing.
It keeps the theme going.
Yeah. So what else is going on?
What else is going on?
in our 4 minutes.
Uh-oh. Who's calling me? I don't think
Well, it's the bat phone. The bat
So,
phone is ringing.
I guess
Who do we have to rescue tonight?
Oh, please don't even say it.
I know.
That's how things have been.
I know.
All right, let me put that on.
Yeah, I got a call from my sister. Got a call from my sister today, and she had to have a tooth extracted unexpectedly from years ago, one that had a root canal, which is always just something you want to go through. And my sister has teeth that are just as big on the outside as they are underneath. So I was asking her fiance, I'm like, did they have a hard time getting it out? He says, yeah, we were going to try to get the tow truck to yank the thing out. I'm like, oh.
It's a bad time when they've got 4 people pulling on one tooth.
That's it. I go, gee, is it stress related? Are you grinding your teeth too much? Or because she certainly doesn't eat sugar or anything. It's probably just an age thing, We're just wearing out our parts.
Well, that's what I keep saying over and over again. It's the genetics problem. You can do all the things right, and in the end, it's the genetics that are going to get you.
That's right. Anything happens, I go to my mom, thanks, Mom. And she just starts laughing. Thanks,
Okay.
Mom. She just laughs.
That's how it all works out. It's those genetics.
If you're just joining the madness here, this is the BA Zones live pre-show. We're just chatting about absolutely nothing. It's kind of like a Seinfeld episode. You can make a whole show out of talking about nothing.
Yes, we probably could.
And we probably could. And we've only got about a minute and a half, I guess, before we actually start this evening's program. We're going to be discussing rules and regulations for healthcare, particularly, not following those rules and regulations or fraud. And it does sound like Freud. Does it still sound like Freud?
No, but now I made you self-conscious. I'm sorry. I shouldn't have said anything. It cracked me up because it was sort of an interesting parallel there.
Yes, a little play on words. I meant to say that.
Yeah, that's it.
Just not
How's Mr. Tink doing?
Mr. Tink, well, because of his vision issues, he's not exactly used to this place. So he's like wandering around again and doing the bump thing, but he's okay. It's a lot of long flat hallways here, so we're good. There's not a lot to crash into like there is up at home, so he's pretty good.
Oh, that's good. Gives him a chance to.
He's lying about somewhere. Yeah. He's lying
get a high
somewhere.
Stool, put a little bed on it. He can sit next to you.
I could, but then during the show, he'd probably decide to take a walk and fall right off the table because he can't see where he is. So, that would be bad. Put a leash on him, then he'd be hanging.
No.
He has a harness, He'd jump off. He'd look like a tea bag hanging there. I couldn't do it.
Murphy was in here keeping me company while I was doing all the setup. And as soon as I said, okay, it's time to get ready, he went in the other room. I don't know why he thinks that's what he's supposed to do, but that's what he did.
He's camera shy. He's
in a little bit of a mood tonight, and I don't blame him because the dog walker failed us again. Not only that, but he's lying to me, which is a whole other thing. But yeah, he left me a note saying that he took him for a walk, and I know for a fact he didn't because I saw on the webcam that he came in and he brought him in the backyard. What I really don't understand is he brought him in the backyard on the harness and leash. I have a fenced-in backyard. And when they came back in, Murphy was still on the harness and leash. So I'm not happy. Murphy's not happy. I always know because I'm a maniac.
And on that note, folks, we are ready to start our live show this evening.
Unless you know somebody who can be a dog walker for me, in which case, get in touch.
Yeah, please drop us a line, a comment. And there goes the show. No, really. Just let's start by introducing ourselves. If you haven't joined us before, I'm Marianne Morrison.
And I'm Kathleen Sinnott, looking for a dog walker.
Looking for the dog walker. And we're the BA Zone, and we're here to fulfill all your needs, BA Zone related or business, any type of business questions. And as we go through, please drop us a line. You can find us today everywhere. Kathleen will bring up those sites. You can find us on Twitter at the BA Zone, on Instagram.com, the BA Zone, Periscope TV, and welcome all those folks, and Facebook. And we are on YouTube, and you can also find us at thebazone.com and catch our previous shows if you've missed any. So tonight's show, we're continuing this month's theme on business analysts in the healthcare domain. And we're going to be talking about rules and regulations, and not so much the actual rules and regulations, but what happens when you don't follow the rules and regulations, and specifically around fraud. You know, we deal a lot in healthcare with claims data, with personal data, and there's a lot of fraud schemes that happen out there. And there's prevalent ones that have been happening forever. And I was a reimbursement manager for about 10 years, quite a while ago. And so we're going to be going over some of the most common methods that are out there for healthcare fraud. And we'll start that off since there's about 10 of them, I think. So we'll just get right into those types of things. The first one, well, let's define healthcare fraud. That's a good idea. Healthcare fraud is considered the intentional concealment or deception or misrepresentation of information, person or entity in order to receive benefits or financial profits. And it is a crime. You know, it's a white-collar crime, fraud. It's something that especially federally funded government insurance companies or programs are all over and like to prosecute, and that would be Medicare, Medicaid. And there's also, you know, commercial, large commercial insurance companies as well. You know, it costs billions of dollars a year in healthcare fraud. So let's discuss some of the methods that occur so that you're aware if you get into any type of the healthcare domain around claims or business practice or physician's practices. Let's start with the first one, physician self-referrals. This one used to be really big well, back in the 80s and the 90s. And this is basically where a physician has a vested interest, or their immediate family might have a share or a vested interest in or own another type of service or facility. And you'll go to the physician and he would recommend you to that facility or service. You can't do that anymore. You can't refer them to, because it looks like you're sort of, you know, just directing them right where you can make more money. So that's one. And there's actually a law around that for the federally funded programs called the Stark Law that doesn't allow you to do that anymore if you have ownership in a vested. So, you know, if someone recommends to you as a patient, you know, to go to this facility or anything, they may have an interest in that. The second one would be kickbacks. So a kickback is basically anyone who pays or solicits or offers gifts or monetary things in order to steer a referral or encourage you to use a particular physician to get a referral or a particular product. So years ago, salesmen used to come in and give you all kinds of things for free. But because that is sort of looked at on as more of a kickback now, you don't see that as much anymore. So you don't want anybody offering you money to refer them to a particular physician or a practice. That would be considered fraud, insurance fraud as well. There is something called unbundling and bundling of services. Unbundling of services, basically, which is the next, yeah, thanks, Kathleen. Unbundling is when you're submitting a lot of separate bills for something that could have all been billed together. So it's kind of like when you go out to dinner and you say you're going out for like a roast beef dinner. You'll get maybe a soup or a salad. You'll get your roast beef, your potato and a vegetable, and your dessert. And that would be considered, and you get all of that for one price. So that's sort of considered a bundled product. An unbundled product is sort of like when you're buying off the a la carte menu, where everything is charged individually. So you're going to pay for your vegetables, you're going to pay for the meat, you're going to pay for the salad or the soup, and you're going to pay for your dessert. In that way, you can make more money by unbundling things and charging money separately for each individual item. And that can happen in healthcare as well. So, you know, if you went to a hospital today and you had a particular operation and they literally charged you for individually for every single item that you incur, that bill could be potentially much higher than if they bundled all of those amenities or individual pieces into one price. So back in I think it was back in the 1980s, Medicare actually started billing by DRG, which is sort of diagnosis-related groupings. And they would look at they had a formula to do this, to figure out, for example, what an appendectomy would cost and how many days you should stay in the hospital. That might be an outpatient procedure today, but in any case, how many days, is the average length of stay. So before that, they could have charged for each day you stayed in the bed. So there was sort of an incentive to keep you in the hospital longer. Excuse me. And they would charge you for each individual thing. So this way, they averaged out that rate, and then they left it up to the hospitals to make sure they were keeping the patients in that needed to be kept in, or releasing them when they needed to be released in order to make a profit. So it's sort of averaged out. The sicker patients with the same diagnosis might take more days and more services, but then these folks over on the other side would take less and they'd be discharged. Now, of course, all other ways to commit fraud came out of that as well. People were discharged from the hospital too soon, so they had to add extra laws and regulations, making sure that you weren't readmitted too soon or you were penalized. So it's sort of a work in progress, but obviously bundled is much better for payers or insurance companies than unbundled services. So in unbundling, a lot of things can happen, such as the next piece, the next slide, which is overcharges. You've seen and this happens all the time, you're padding a bill, in order to charge more. And so everybody's heard about, the military, or maybe you haven't, the military selling individual toilets for like $5,000. This is sort of padding the bills. So, it happens in hospitals with, like, say, medications. You might see aspirin or pain relievers individually, one pill, being charged at $50 or more, depending. And these overcharges could be substantial. So when you have unbundled services, overcharges tend to creep in as well, charging as much as you can get. So, and I'll stop right there for a minute and take a little break, because I know if anybody has any questions or if they've had any experience with any of these pieces of fraud. And while you're thinking of that and commenting in this, I'm sure Kathleen always has some news to give us while we're doing our program. Don't you, dear?
Of course.
She always does.
I'm making everything work back here, and I've got some stuff for you folks out there. We have been telling you for a while that we've been working on for some new stuff, and we have one of those for you tonight. And that is, we've put together a healthcare terms glossary that we'd like to give you. And all you need to do is sign up to join our mailing list, and then we will be glad to send that to you for free. So if you go to thebazone.com/healthcare, we just need your email address. You will get a response back verifying that you did ask for this, so that like your friends aren't doing it as a joke. And once you confirm that you really wanted it, then we will send you a PDF that has a list of the most common healthcare terms that you're going to run into as a BA, so that you can start to either refresh your memory if you're already working in healthcare, or if you're looking to move into healthcare because, hey, it's a booming area for jobs. It'll help give you a leg up, because you'll be able to start getting familiar with some of the terminology. So like I said, it's totally free. We just ask that you sign up for the mailing list, and you can rest assured that we believe in karma, and we will never ever hand out your email, sell it, or do anything else nasty with it. We just do it so that we can let you know what's coming and offer you freebies like this. So again, if you go to thebazone.com/healthcare, and you will be able to then just give us your email address, and we will send you the healthcare glossary that we put together for you folks. And if there's anything else like that that you would find helpful, please let us know. We've done one earlier for the surveys, and if you want that too, just reach out and let me know, and I can send you that directly. But that's the kind of material that we put together because people are asking for it. So don't be shy. If you have a need, let us know, and we are very happy to fill that for you. It's all part of the service.
That's right. Okay, great. We're good. All right, so we'll continue on then. after overcharges, there's a term called upcoding, I should say, upcoding. So, when you submit in claims for reimbursement, there's codes attached. That's how you get paid. There's various codes, and they're actually in our glossary, most of them. But CPT, those are procedure codes. The term upcoding comes from when you fraudulently bill for services or products that are either for diagnoses that are more complex or expensive procedures, more expensive than the one they were supposed to have, or they are of a higher severity than what actually was provided or occurred. So, this happens even, and I've been in physicians' offices actually, and I've been standing right next to someone. And this was years ago, so I can't even remember who it was at this point. But they used to print out, what CPT code they were charging you for, and diagnosis code, and it was right there, and there was a price next to it, and you got your little receipt. So there was a woman standing next to me who said, this doesn't look like what I was in here for. And she said, this one is going to be a covered service as opposed to what you actually had that was non-covered. So actually that is a fraudulent bill. At the time, I didn't know because I was much younger then. So it could be that they're giving it to you. And of course, people who are getting something for free, a patient, they're not thinking as in terms of fraud. They're thinking, oh, how nice, this is going to be covered, whereas before it wasn't going to be covered. Or maybe this one's going to have a higher co-insurance than the other one did. So that is really considered fraud when you're doing this upcoding, changing services or products or diagnoses to suit the type of reimbursement or the type of payment that you're going to get back. This can happen even in hospitals. Sometimes you ask for a private room and they upcode you with, you're in a semi-private room and they charge you for a private room. So those are kind of things that you look at from billing. If you ask for a detailed bill, you do have to do that from a hospital, otherwise you wouldn't know. But that's the term of upcoding. It's just picking a code that's either going to be covered or is going to get you a higher price from what was actually provided, or the service. So fraud, lots of fraud. Also in that same line is unnecessary or extended treatments and services. This can get particularly dangerous for patients. There's a lot of schemes, and these are only some of the schemes that occur. There are very complex fraud schemes that happen out there. But unnecessary extended treatment is providing literally treatment for someone that doesn't need it, or extending that treatment beyond what is medically necessary. And this occurred a lot in the 90s, if you remember, with Lyme's disease. There was a lot of Lyme disease specialty physicians out there who were literally treating people for Lyme's who did not have Lyme's. That was a big one. There have been cases in the past where physicians were giving patients chemotherapy who did not have cancer, all in an effort to make money. There's been unnecessary C-sections instead of vaginal births. The opioid epidemic is something that happens with the extended treatment, extending a treatment too long. There are many people who have become addicted to opioids because there is an ongoing extended treatment plan to get these people to keep coming in for office visits so they can charge for that service, and people have become addicted to that because of that. So, and then there's also the more subtle types of unnecessary treatment, where you sort of throw every test or procedure in the book at someone. And it could be that you are, this typically happens with people who, the elderly, who may not know any better, or who figure I need all these tests, people who have mental issues or addictions, or hypochondriacs, or folks with Alzheimer's, or dementia or less capacity in some way, it's easier to put these, keep them coming in for test after test after test, unnecessary tests. So that is fraudulent behavior as well. Beyond that is also billing for services, hey, that never even occurred. They never happened. They were never performed. These come in the form of, forged prescriptions. Again, the opioids come into play there. People are forging consents. It can also include things such as cancellations of services. So, for example, if you had a service that you were going in for, or a procedure you were going to, or it was canceled at the last minute, it could still be billed for fraudulently, obviously. And they charge you anyway for that. And there's also a lot of medical identity theft out there, actually creating bogus patients by stealing information from folks in order to bill for these types of services and get basically free money. Also, there's a law around waiving, and mainly these laws are around Medicare and Medicaid, but waiving deductibles and co-pays or co-insurance. Occasionally, something might be waived for a given reason, but if there is a consistent practice within a physician group or a facility of some type where they are constantly waiving deductibles and co-insurance, that's not allowed. It's considered breaking a health insurance contract. So you're not allowed to do that. That's a fraudulent practice. And I know when I go to the doctors, my primary care physician, they always give me this little piece of paper, with my signature that I paid my copay. And I always thought about that. I'm like, well, why are they doing that? Because I have proof that I paid by a canceled check, but they're doing it for their own practice. If they're audited, they can prove from a documentation perspective that they are indeed collecting these deductibles, well, not deductibles, but the copays. So yeah, that's considered breaking a health insurance contract. You don't want to do that. Another method of fraud is provider misrepresentation. So that's sort of like submitting claims for services or treatment performed by someone other than the submitting physician that's signing off on it. So there may be times when maybe a physician's, it's a licensed practitioner of some sort that comes that works with the physician and comes in and actually provides the service that the physician is actually submitting a claim for. And what happens is that other provider is probably a lesser paid provider, paid by the insurance company, but the physician uses his name so he can get the higher rate of billable. So that's a misrepresentation of who the provider actually was. And I'm sure there's other instances of that, but that's the first one that comes to my mind. Finally, there's sort of a bunch of other smaller, well, they could be large actually, but adjustments billing or coding folks do or facilities in order to increase their reimbursement. That might be in the form of adjusting service dates or the actual length of stay in order to get more, more days covered, get more reimbursement. There could be an adjustment of quantities of things that have been ordered or products that have been used. You could adjust the location of the service. This happened, I can remember this specifically back in the 90s during the HIV and the AIDS crisis. Physicians were sending patients home with treatments. They could have been injectables or whatever. And that was great, except that they were putting claims in for the patients actually coming into the office for office visits, and that was fraud. So that's an instance where they've adjusted the location of the service. And that's about the top. Those are the most common that I can think of. And again, there are schemes out there. By and large, most folks are honest. There's honest mistakes that can be made with the billing and the coding. But when you see a pattern of fraud and abuse, that raises up a bunch of red flags. And sometimes we wonder how this happens, right? It's like people are checking their bills, they're checking, but they're really not. And a lot of times, again, they are preying on the elderly or the really folks that have super complex diagnosis. Oh, we'll add this in here. They won't even know because they're so ill. So it does happen, and it happens enough that it is a huge, huge amount of money, or people wouldn't do it. And that's about the top 10. Can you think of any others, Kathleen, that come to your mind?
Yeah, there's one in particular. Let me bring that down. That I think is something that people fall into by mistake. They don't go into it necessarily with nefarious ideas behind it, but that is all around the HIPAA violations. We're human beings. We're curious. Let's face it, we're a little nosy. So sometimes if you get your hands on data, you just can't help but poke through a little bit and see what's in there. And I know personally some people who have gotten in trouble who had access to records and were, I don't know, bored at work or something and felt a little silly and started looking for friends, family, neighbors, and then found some. And so then he decided to up the ante a little bit, and they started looking in for like celebrities. They just started typing names in. And unfortunately, they didn't realize that there were some triggers in the system, and so basically they set up some alarms, and they got in a lot of trouble just because they were being nosy and they were poking around places that they shouldn't. Again, this person was not looking to, sell the information to TMZ or anything. They were just poking around to see what was out there. And so this is the kind of thing that, while some of these things you're like, well, of course I would never do that, or my company would never do that, and I'm sure that's true, but you can get in just as much trouble by doing things just because you were poking around, just because you wanted to see what was there. So you really need to be very aware and careful of this type of thing. Particularly in healthcare, you don't want to be the next company on the news, that's, being dragged out because somebody in your company went and looked at something or inadvertently, forwarded something in an email, it was supposed to go to one person and instead they did a broadcast. There's a lot of ways to trip into a problem on these type of things. And even with some of these things that Mayor just went over, some of them are being done on purpose, and that's completely wrong. But some of them could just be, a typo or something like that. But there's enough of them there, it could end up looking like there's a pattern of abuse. And then again, you're going to get dragged into the news and you're going to be brought up on charges, and you just don't need to go there. So you do need to be very, very careful about all this kind of stuff. You need to go into work every day and remind yourself that while it may just be another day at the office for you, you are dealing with sensitive material, and you need to make sure that you follow the guidelines even when they're annoying. And let's face it, they all are. Okay, thanks, Susan. Susan's letting me know there's trouble with my levels tonight. I'm maxed out. All right, thank you, Susan. I'll look into that and see what's going on. I kind of thought that might be the case.
Okay, so let's talk about why this is important. So obviously I've gone over all these different schemes and ways to make money, but when you look at the news, there are there are billions of dollars lost annually to healthcare fraud. So as a business analyst or anyone else interested, there is an opportunity here to create programs to improve compliance or to prevent fraud, to detect fraud, or even to recover fraudulent funds. So example, you could have compliance programs, improved claims or billing process programs, improved patient records, supporting documentation programs, data mining tools to look for patterns or outliers. If you could save a portion of those billions of dollars, it's a lot of money. So there's opportunity here. There's a lot of opportunity. If you don't understand the rules and regulations, you could be complicit in the act. It's not an excuse to not know the rules when you're being hauled into court. And you also may want to be the whistleblower. So you need to know, just so that you yourself don't get in trouble. And overall, all of this fraud is affecting everyone because it results in higher premiums for all of us for health insurance. And it can be physically harmful to the unsuspecting. So there's a lot of reasons why this is important. But the big one here, like I said, is opportunity. There are plenty of things that you can get out there. If you understand the concepts, you can make a big difference out there. And that's my 2 cents on that. Kathleen, anything? Wrap this up?
I think that covers it.
Okay. Any comments from the viewers out there tonight? Any questions?
No, just people saying hello and checking in, but nothing, no specific questions on anything here. So you did an excellent job of covering the material as usual.
Well, great. And again, if you folks want to hear anything in particular, we'll be happy to design a show around it, schedule a show around it. That's what we're here for. We're here to give you a hand. And again, you can find us on Twitter at the BA Zone, on Instagram, Instagram.com, the BA Zone, on Periscope.tv, the BA Zone, Facebook.com, the BA Zone, on YouTube, tinyurl.com, the BA Zone YouTube, and as well on our website, where you can catch all of our previous shows at thebazone.com. And we thank you for joining us. And do we have any other business?
If you would like to cash in and get the free healthcare glossary, you can just reach out and send, if you go to thebazone.com/healthcare, no space, you just need to give us your email address and then confirm that you are requesting it, and we will send you a PDF that has the most common terms that you're going to run into working as a BA in healthcare. So that can be handy if you're looking to just refresh your memory, or if you're coming across new terms and you're already working in healthcare, or if you're looking to move into healthcare. This is a great way to start to brush up and get ready for those all-important interviews.
And as we said in last week's show, you have a glossary that's ready to go, or a start of a glossary that you can just add to any of your requirements or technical spec documentation. So you have that information readily available. Okay, great. Well, thanks again for joining, everybody. And we hope you have a fabulous night, fabulous rest of the week. And we'll see you again next Tuesday, right here, same time, same channel. Thanks a lot, everybody.
Have a good one, everyone.
What?
I just messed up. I was trying. So Susan thanked us. She said it was an interesting topic. And, it's one of those things where it's hard to know, when you're encountering it sometimes if you've never run across it before. So it's good information to have. Unfortunately, though,
Great.
I had everything set up, it doesn't seem to be working for me tonight, so I was bringing up old comments. Oh, well, that's the way it goes. It was a good show right up to the end. I shouldn't have pushed my luck.
That's all right. It's real life, folks, real life.
It's the joy of live, right? All right, everyone. Thanks so much.
Take care. Night.